Unreal. So, welcome today to the Sixth Med online crash course, which is basically just talking about how you guys are going to stand out amongst other medical school applicants. As we know, medical school is there's been an increase in the number of applicants, and the places are staying rather stagnant. I think there's an increase of about 50 something places next year. So, it should give you guys a greater chance, but obviously more people are wanting to do medicine. So this webinar is sort of just to help you stand out a bit more and to understand what you need to show, quantities you need to show in order to make your chance of getting into medical school a bit more successful. So I'll just give an introduction about myself. So I'm Catherine. I'm a current final year medical student at Newcastle University. So I applied to Manchester, Liverpool, and Glasgow. I got a UCAT score of 3,160, I think. It's a long time ago now. I'm feeling a little bit old. And I got all four of my interviews and I got all four of my offers. And 5 years later, 6 years later, down the line, I guess, I'm now about to graduate. So it's all very fun. So we're going to talk about, before applying, the UCAS application, the interview, and basically how you guys are going to have the opportunities to stand out and shine. So why standing out important? So at the minute, there's about 10 applicants per medical school place, and this is only going to increase. More and more people are applying for medicine, so I wouldn't be surprised if for your year it's a little bit higher. Everyone is very clever. You wouldn't be applying for medicine if you weren't. And everyone, or most people, are very, very caring as well. Everyone wants to be a doctor because they care about people and they want to help people. So you do have quite a short time to shine. This in interviews and in your UCAS applications is not a long time in order to shine. And different unis want different types of doctors. So if you go down south to Oxford or Cambridge, for example, they want doctors that are going to have a really high research output. They're looking for a lot of academic doctors. I do know someone who interviewed at Oxford. They do go there now, to be fair, but in the interview they said what they wanted to do. I can't remember what it was, and they said, "Oh, we aren't really looking for that sort of clinician. Like they want research people." Meanwhile, for example, up in Newcastle, we have a really high output of people who want to become GPs. So I probably don't fit that trend, nor do any of the people I live with. One of us wants to be an ENT surgeon. I want to probably do oncoplastics or orthopedics. My other housemate wants to do anesthetics. So we don't really fit the trend of GPs, but a lot of our other friends do. So just look at the unis you're applying for and what you're sort of interested in, because different unis are going to want different types of doctors. So starting with work experience and experience in healthcare. So what's available? So there's GP, obviously that's the first port of call, the primary care aspect of it. There's hospitals as well, which is tertiary, quaternary care, where you get referred to for more sort of specialist help, or if you are in some sort of acute trouble, obviously you would go to A&E. So that is also a hospital experience. Then you've got hospices and elderly care homes. So hospices are really where people go in, I guess, the last months, the last days of their life to make them comfortable. And I guess a lot of people don't really look at it as healthcare because essentially there is no treatment that is going on at that point. However, it's just about keeping people comfortable and affording them some sort of dignity in the final weeks to months of their life, which I'm pretty passionate about because I've just spent my last 4 weeks on placement at the palliative care unit, and it showcased a really different side to medicine that I wasn't really expecting, I guess. And then we've got elderly care homes, so I guess that sort of speaks for itself as to what goes on there. I've got healthcare assistants as well, so those are really sort of people who work alongside within the MDT, and they can see patients and do all sorts of jobs and stuff. We've got vaccine drives, so obviously COVID is a huge one that's just gone on. You've got online theatres, and why is it important? It's different to being a patient. So you working within that in your work experience, it's is different to being a patient, experiencing the healthcare firsthand and seeing how it's all sort of put together in order to afford an efficient and I guess a unique experience for each patient is so important for you to draw on and for you to be able to talk about in your application, interview, wherever. You also get to experience the MDT. So MDT is a keyword that we all look for. I've interviewed for medical schools before. I've been the interviewee, but recently I've also seen the other side and I've been the interviewer. And MDT is really a keyword we look for. And knowing who is part of the multidisciplinary team. I think it's important to know technically everyone's part of the multidisciplinary team, even the patient, because we are very passionate in medicine now about shared decision making. So obviously the patient should really be involved in what is sort of going on and what treatment they're going to have, and they should have some form of input on that decision. It also helps you understand the role of the doctor. I think a lot of people, when applying to medical school, I was one of these people. You just think the doctor's the leader, the head of the team. Sometimes they aren't. Sometimes they're like, there's other people who lead the team. You've got specialist care nurses that know a little bit more sometimes and are leading the team. The doctor's sort of taking a back role. Yes, I appreciate they probably always help coordinate the team, but just understand that role of a doctor because you need to be able to talk about it because it's what you obviously want to do. Understanding the lifestyle. So I think we have to appreciate the realities of the lifestyle of becoming a doctor. Having recently received my contract and some aspects of my rota, the lifestyle is very different to what I was expecting at your stage. And understanding the realities is so, so important. Don't go into it blind. You are going to be working a lot. You are going to have 13.5-hour shifts. But you're also going to have days where you have 8-hour shifts. You're going to have bad days. You're going to have good days, but that comes with every job. So just make sure you understand that lifestyle of being a doctor. And it shows proactiveness by doing work experience. So it shows that you actually want to learn, you want to be involved, even at a stage where you probably can't do very much. I know that during my work experience, I sort of just sat there just watching. So you can't do very much, but it's the proactiveness in trying to get that work experience that we also like. And then longer term experiences. So let's talk about what's available. So you've got school. Some schools will do things such as mentoring or prefectships and things like that. So that's an experience that you can translate to medicine. Tutoring. Half of you will be in your, well, maybe not half, most of you should be doing your A levels now. Some people will be a little bit younger and just sort of gaining more information. But if you're doing your A levels, why don't you look into sort of tutoring GCSE students? You've just done GCSEs technically. So your knowledge on it is probably quite good and definitely a lot better than mine, who does or used to tutor sort of GCSE students. So, draw on that as well and translate that to medicine. Paid work is important as well. So I think a lot of people are always like, oh, I don't have medical work experience, but I don't know, you could work in, for example, size, and you can use that for your medical school application. You can use that in your interview. Talk about working in a team, problems that you had to solve at work, which literally applies directly to medicine. So it doesn't actually have to be healthcare work experience. As long as you have something that you can talk about, it's all good. Then you've got volunteering. So a lot of people here volunteer at care homes. Some people probably volunteer in the hospital as like the Meal on Wheels people and things like that. So volunteering is important as well. And then just helping in the community. So you might have like, I don't know, a community. We've got a community church right opposite us. Might have a community hall, like sort of helping do stuff within that environment as well. Is something else that's also available. And why it's important. So it shows dedication to the cause. It shows dedication that you want to be a doctor, that you want to do medicine, that you don't want to give up, sort of resilience. It shows compassion. So depending on the experience, you can show compassion for it. It shows social skills from working with other people. It shows confidence that you've gone out there to sort of find this, to do this. and they're also transferable skills. So that's why I was talking about it doesn't matter sort of what your job is, you can always transfer the skills that you've learned to medicine. Hobbies and passions. So prefectships, which I've also already talked about. Head of house as well, that's another one. You've got organising clubs. So a girl I know, she organised a club for like sort of children in our school who had special needs. So it was for them to sort of come during lunch times and they could just like put on a film that they liked or and just like socialize with each other like they struggled socially. And so she organised that at school. Playing instruments as well. So I played violin for a while and I use that in my application to say that it's increased my hand-eye coordination and my ability to analyze. And then I use that to talk about like analyzing x-rays and stuff. So you can honestly just translate anything you want. And then sport as well. It's important to have hobbies outside of medicine. I do, and a lot of my, well, I guess colleagues now, because I'm technically a doctor, but like when people have personalities outside medicine, medicine can't be your personality because you've never done it before. So let your interest show as to how you're going to deal with medicine. Like, are you going to play tennis? Are you going to play football? When you've had a hard day, like let your outside interest show because it's so important. Any hobbies are important. It doesn't matter what it is. We've got a Quidditch society in Newcastle, for example. Like any hobby is important. It's just how you're gonna manage that and keep it within sort of when you're studying medicine. And then school subjects as well. So why are these hobbies important? It shows you'll have a good work-life balance, which we just talked about, social skills, organization, leadership as well. And it shows that you have a passion. Medicine, hopefully for all of you here, will become a passion, but it's important to have passions with other things. I forgot to say as well, if anyone has any questions at any point, just put it in the Q&A and I will answer them. It doesn't have to just be me talking. I will answer any questions you guys have. So personal statement. Now, this is very, very important. I remember having an absolute fear when I was writing my personal statement, just so I didn't understand what it was. And as far as I'm aware, it may have changed a little bit for you guys. I thought it was going to be questions, but I've just been corrected yesterday that it's still sort of, you can write the 4,000 characters. I've looked at it this morning and it says it's a minimum of 1,000 characters. So if that's not right, just let me know. But I looked on the website and essentially it can be anything between 1,000 and 4,000 characters. If you're going to be a medic, it's probably better to edge towards those 4,000 characters so you can sell yourself completely, I think, would be the advice I give you. But obviously, I wrote my personal statement 6 years ago. So it was a little bit different. Everybody had to write 4,000 characters. Also, just look at the unis you're applying to. Newcastle, for example, we do not look at the personal statement. We have never looked at the personal statement. And as far as I'm aware, I don't think we will be looking at the personal statement. Normally, the personal statement is for Newcastle, is just to check that you're okay and you've not written anything slightly off in your personal statement. So that's just at the end of the whole process. But I don't know anyone who's ever not been given an offer because of their personal statement at Newcastle. I cannot speak for other unis. Liverpool, in my interview, I had to print off my personal statement and take it with me, give it to the interview people, and I was quizzed on my personal statement. And that was the same for Manchester as well. So make sure to look at all these things for your different unis and to see the importance of the personal statement or non-importance of the personal statement, because it will probably judge how much effort that you do put into your personal statement. I'll be very honest with you. Say in your personal statement, what did you learn from all your experiences? You want to include that. You want to be unique. So let's not start the personal statement with, since I was a child, I've wanted to do medicine. Firstly, you probably haven't wanted to do medicine since you were like 3. But also you definitely just, you probably wanted to be an astronaut or something, like legitimately, like that's fine. but a lot of people start their personal statements with that, and it doesn't make you stand out. You want your own unique sort of entry. So I'm just going to quickly actually find my personal statement and tell you guys how I started my personal statement. Um, I'll find my personal statement at the end because I'm not actually sure where it is. Um, but I will find it and I will let you guys know how I started my. Oh wait, no, I've got it here. 1 second, sorry. So I started my personal statement with shadowing doctors and experiencing a hospital setting can never give complete knowledge as to what the job entails. Yet it has afforded me invaluable insights and has served to confirm my goal to become a doctor. So that's how I started my personal statement. So you want a unique way to start your personal statement. You also need to sell yourself. You need to write your experiences. So I talked about time I spent in Nigeria with a family friend, but I also talked about a time that I had at Manchester Children's Hospital with my auntie as well. So sell yourself, use your experiences to talk about, but also be clear and straight to the point. Don't be really wishy-washy. You've only got 4,000 characters and it seems like a lot. And I thought, oh my gosh, this is so much. I'm never going to use all these characters. And at the end of my second draft, I was about 1,000 characters over. Just be clear and straight to the point. So a lot of it is like the same thing that you're saying over and over again. You don't need to include the areas you've done things in. You don't need to include the names of the hostels. Like that's just wasting characters. Cut down on those things because they're not bothered. And then remove extra words. So sometimes you can say like you might have but, just put a full stop there and start a new sentence. And then that obviously will remove 3 characters. And then get a proofreader. So utilize the various people you have in your life. So I use my parents, I use my teachers, but try not to give too many copies of the same personal statement to different people. So this was a piece of advice that I got in sixth form, and it actually was very important in the end. So if you make sure that anytime you're giving your personal statement to people, you only give it to a maximum, sorry, of about 2 people, because you don't want to give your personal statement to someone to like 5 people. You're making changes in the background because 2 people have already got it back to you, and then you go, someone else gives it, but you've already made a change on that, so you've got to actually give them a new version. So make sure to only try and give it to sort of a maximum of 2 people. So what to include in your personal statement? Include your motivation for medicine. Why do you want to do it? We want to know, why do you want to do medicine? Developing your interests. Are you interested in any specific aspects of medicine? Why are you interested in those aspects? Your work experience is very important to be included if you have them. Not everybody has work experience, and that's okay. Your hobbies as well. So I included playing tennis in my personal statement and playing violin. So include your hobbies because that's you being very personal, and is also what's going to help you be unique from other people. So include your hobbies and include your strengths. Strengths are very important. What you're strong at, is it your interpersonal skills? Is it your communication? Is it your adaptability? Is it your resilience? Put what you're strong at, because we want to know your strengths and how they will translate when you become a medical student at any of these universities. So the layout of the personal statement is 4,000 characters, as I've spoken about already. You've got a brief introduction. So like how I sort of just gave you guys my introduction, quite a short. Well, actually, mine wasn't very short. A lot of people I know is a lot shorter than mine. But just a snappy, short introduction, only about 2 lines. I think mine was 2 lines. of your personal statement, that's what you want, because that's what's going to draw them in if they read your personal statement. Your motivations, so what's drawn you towards medicine, what experiences have drawn you towards medicine. You then want to talk about your sort of experiences and skills and any other interests you have. And then you want to conclude it at the end. So you want quite a, I would say the conclusion is more important than the introduction, because I think that's how you wrap it up and what's like makes them like sort of say, yeah, we want them, he, she, whoever you might be, it's what's going to make them be like that. So I ended mine with medicine is not a course where everything is learned during the 5 years of university lectures and clinical placements. From each patient who walks out the door and the many who might not, from the critically ill to the simple abrasions. I will learn with each passing day in order to handle the situations that may come my way. I look forward to working in a multidisciplinary team. I'm not daunted by the challenges. I relish them. So looking back on it now, I think I probably could have improved on it. But at the time, I really liked the way I sort of wrapped it up. But I guess it's not important anymore, is it? But I guess if you sort of like think about mine, I acknowledge that I'm not going to learn everything in my 5 years. It is continuous learning. So we didn't say explicitly that it's continuous learning, but I implied that it is continuous learning, and they should be able to infer that it's continuous learning by what I've said. I acknowledge that not everyone is gonna survive their treatment. That is the reality of medicine. Some people are going to come in and they're not going to leave that hospital. So I acknowledge the realities of the job. And I acknowledge the range of patients that you'll see. So from the critically ill to people who are probably going to need CPR at some point within the next couple of hours. And then to the simple abrasions where you're just patching someone up. I remember one of my first times on pediatrics was just like glue this 1 centimeter cut on a 4-year-old's head. So, you know, there's very simple abrasion there. And then I put about learning with each passing day in order to handle situations that may come my way. No day is going to be the same. And that is one of the good things about medicine. A lot of other jobs, you're going to go in, you're going to do the same thing every day. There might be a one-off where something cool happens that doesn't fit the norm, but you're probably going to be doing a very similar thing every day. But medicine is not like that. And I then said I look forward to working in a team. So that just shows that I want to work with other people. I know I'm going to work with other people. And then I've talked about obviously the challenges. I am going to have challenges, but I'm going to basically try and be resilient and overcome them, which I hope I have sort of done over my time at medical school. I mean, the last 8 weeks have probably been the most intense because we're actually on placement now working as F1s. Before that, it was more just shadowing and stuff, but sort of becoming a little bit real. So I sort of acknowledged all those different things in my conclusion. I acknowledged probably more things than you should, I guess. But yeah, the conclusion is very important in my experience. So talking about motivation, so you want to talk about your personal experiences and why you're motivated towards becoming a doctor. And everyone will have their own unique reason for wanting to become a doctor. It could be a family illness. It could just be you want to be a doctor. It could be you did want to be a vet, but then you can't cope with the concept of animals being put down, so you change your mind. There's going to be different reasons. Everyone's going to have unique reasons how you talk about it in that personal statement and in the interview as well. You want to talk about how you developed your motivation. So sort of through, I guess, work experience, online courses. I can't remember what that online course is called. I think it's Coursera, maybe. There's online courses anyway. There's like MOOCs as well that you can talk about, and that's how you develop your motivation. But keep it short, short, sweet, seals the deal. Just think about if you were reading it, would you get bored halfway through? And if you did, would your attention be drawn elsewhere? If your attention is likely to be drawn elsewhere, then cut the sentence down a little bit, is what I would say. And consider your audience. So it's become a little bit more difficult because I know a lot of medical schools. So we here We have doctors, we have nurses, we literally have a range of healthcare staff. But also recently, we've started getting volunteers, like just from the public as well, to read the end of the personal statement. So just consider your audience. It could be anybody reading that personal statement. So I guess you just have to sort of ensure that regardless of who reads it, you would be selling yourself to them. And talk about your experiences. So break it down, like you know your experience, but the person reading it doesn't know your experience. So you want to make it sort of easier for them to follow. Can you go back to the previous slides for about 10 seconds? I can. If I, yeah. Just let me know when it's okay to sort of move on. Okay. So break it down. You know your experience, but they don't know your experience. So you just need to sort of make it easy for that person who's reading it to follow your experience and sort of be like put themselves in your boots as to what you experience. Talk about what you learn as well. Everybody has their own individual situations. So it should be individual to you. Cut any unnecessary detail. So, for example, the location. This is something that people always waste characters on. You don't need the location and you don't need the name of hospital. It literally makes no difference. It is not going to sell you anymore because you did it in Great Ormond Street compared to if you did it at Alderhay, for example. They're both children's hospitals, I guess. So it's not gonna sell you anymore. And vice versa, if you did it at Alderhay compared to Great Ormond Street, and you're applying to is Alderhay in Liverpool, I don't know, and you're applying to Liverpool, it's not going to sell you anymore. So it doesn't make a difference. Just cut it out. You don't need it. And prioritize. So write a list down of your experiences and number them from one to whatever. One being one you want to make sure you include, and I don't know, four or five being the one where you're not even bothered if it's even there. To number it and prioritize the ones that are important to you that you think are going to make you, I guess, look better and sell yourself more to that person reading it. So an example of this is I spent a week in hospital shadowing doctors and nurses. I saw a dermatology clinic and spoke to patients. And then we'll give a better example. So on work experience in hospital, so they've said it's work experience, that's your proactiveness. I had the opportunity to speak to patients. One patient had that, fine, just make sure it's not identifiable. And while speaking to them, I realized the importance of X techniques used in consultations. I realized I was a strong communicator and demonstrated this by whatever. I was surprised when I struggled with whatever. And so following this, whatever. It shows development, it shows appreciation of your limits, which is important. If you look at the GMC Good Medical Practice Guide to Good Medical Practice, they always talk about recognizing your limitations. It's one of the key things for being a doctor. So there's that. And then they've also acknowledged like the importance of techniques that I guess the consultant or the other doctor, the ST5 might use as well. So that's a much better example of how to talk about your work experiences. So the interview process, which I hope all of you will get to. I want to be very honest with you here. The toughest part of the medical school application that myself and a lot of my friends found was that time period between when you sent off your application and when you're waiting to hear back from interviews, to know when you're waiting to see if you've got an interview. That was sort of the toughest part for myself and a lot of people I know, because you do find yourself on things like Student Room or Twitter a lot to see what sort of average dates people are expecting it. You then find out that someone's heard back that you haven't heard back, and it starts freaking you out. Don't let any of those things daunt you. I'm not going to tell you not to go on Student Room, and I'm not going to tell you not to go on Twitter and look at it, because you're not going to do that. You probably are going to look at it just out of curiosity, but don't let yourself stress out about it. One of my friends stressed because I got an interview to Glasgow, and she hadn't heard back. Now, she stressed herself out about it, only for a week later, her to get an interview from Glasgow. And then we looked at it, and it was like Glasgow send out their interviews in UCAT score order. So that's, but they only like gave that information out right at the end of the whole interview process. So she stressed herself out for no reason. So don't allow that time period to sort of wear you down. You've got other things to focus on. We've just started your second year of A levels, like that is going to be tough in itself. So don't let this weigh on you. If you can't drive and you want to learn how to drive and you have the facilities to learn to drive, do something like that. Try find something to put your head into that you can focus on outside of this, but don't let this let you beat yourself up inside. I would argue that waiting for the offers is a much easier time period than waiting for the interviews, to be honest, because I think you can often gauge how your interview's gone, but up till the interview, you've got no idea what might happen. So talking about yourself, be humble, but don't be too humble. So you need to sell yourself. Don't undermine your experiences, like they're good, but also don't make out like you were the most important person in the room, because you probably weren't. Unless you were in that given situation, you probably weren't. So be humble, but don't be too humble. Back up everything that you have to say about yourself with examples. So if you're saying you're a good communicator, give me an example. I'd always go in my interview, my go-to is DV for communication. So always have a go-to. I would recommend sort of getting a table and writing down different skills you have, and in another column writing down an example of how to back yourself, like how you would back yourself up with that. I did that for my interview. I just wrote, sort of learned it. I didn't carve any answers in my head because I didn't want to sound robotic. That's another thing. But I knew what example I was going to use based off what question they asked me, and I just carved an answer on the day from that. Talk about your experiences. So when you talk about yourself, always talk about different things that you've experienced that allow you to be who you are today, essentially. What makes you you? So what is the quality that if you removed, you wouldn't be yourself anymore? We want to know about that. And talking about your sort of weaknesses. So sometimes people aren't good at certain things. Often you'll probably get a question and say, what's your biggest weakness? Mine, the go-to I went with was public speaking. A lot of people go with the public speaking bit. I am actually rubbish at public speaking, and it is my biggest weakness. But I'm working on it, guys, don't worry. But I think that's probably the most common one now that people go with. So if you've got enough weakness that isn't going to dob you in, but is going to look good when you talk about how you're working to improve it or how you have improved it, and how you're going to make it become a strength, then that's good. But if they ask you about your weakness, just answer the question. Like, don't start talking about, well, we could talk about my weaknesses, but I also have strengths. Like, don't do that. Just talk about your weakness and how you're gonna enable it to be a strength. So always frame it exactly as a previous weakness, like I said just now. What actions did you take or are you taking? How have you improved to make this better? And how are you continuing to improve? So if we talk about my weakness of public speaking, so I guess I have got better. So I'd be like, I used to be terrible at speaking in public. I guess, yeah, maybe I have got better because I am on this webinar now. So I used to be terrible at public speaking. I would get so nervous. I get quite hot, sweaty, and I couldn't stop shaking. And I realized that as being a medic, it's going to be so important to be able to speak publicly about maybe advancements or treatments and things that I've done um, in front of other people. And I also have a huge passion for research, and a huge part of research is going to be presenting it. The actions I took were in third year, I did an audit. And when I was writing my final application to become a doctor, because you've got to sort of apply to all 21 deaneries, which you guys will learn later down the line, I realised that I actually wanted to do the academic programme, which is a sort of different programme to the more to the normal foundation programme. So I would have an academic block where I could do research, but there's people get interviewed, and it's separate. I think there's about 800, maybe less, out of 12,000 jobs that are academic, and a lot of people do want the academic program. So I realised I wanted to do the academic program. In order to do this, I talked about my audit already. I presented my audit in September at a national conference. This was just a small poster presentation, so it was in front of about 10 to 15 people. But for me, that was a huge leap from going from someone who could only talk in front of like 5 people to now taking the step and going to 10 to 15 people. How I'm continuing to improve is I'm currently doing a project with the HPV team at my hostel that's local to my uni. And this should result in an international presentation, which is going to be a presentation on a much bigger stage in a different country that I've probably never been to. But it's going to put me in that sort of environment in order to improve further. So that's how I would frame it. But obviously the me framing that now is me talking about the current experience as a 5th year. It's different from how you guys are going to talk about it at your A levels. But if anyone wants to sort of talk about things that they would say, just put it in the chat, and I can sort of have you sort of frame that a little bit. It's just a bit too long ago for me to think about 6 years ago on what I would say. So also think about a positive situational work experience and a negative situational work experience. So you want to have one of those at hand. They might say like an example of something that went really well, but they might also say an example of something, give us an example of something that went really badly, but how you sort of work to solve it. So have those sort of in your back pocket ready to say, because you don't want to be just caught unaware in your interview. And why that medical school? So a lot of medical schools start off their first question of why Newcastle, why Liverpool? Read up on the local area. I want to know what you know about the local area. I want to know what you know about the hostels. I want to know what you know about our medical school and what's unique. Is it dissection? Is it prosection? Is it clinical placements from day one? What is it about our medical school that you want to go to? Like, why do you want to go to that medical school? So they might ask you why medicine, and they might ask you why at the University of Manchester. So I applied to Manchester, so I can sort of answer that question, I guess. So if they had asked me why Manchester, I'd have been like, I would have started off with the course. So Manchester is one of the very few unis, I think it's one of 4 unis now, that does dissection. Dissection is when you get given a whole body at the start of the year and you dissect it yourself. Majority of other unis do prosection. So for example, when you're doing the arm, the upper limb, you will literally just get given an arm that's already dissected. You can see the radial artery, the ulnar artery, median radial ulnar nerves. You can see the pulley system. You guys have no idea what I'm talking about, but it's already dissected and already pinpointed for you. Whilst at Manchester, it allows me to do that dissection myself, to make my own mistakes. As someone who wants to be a surgeon, knowing that anatomy, knowing how to dissect is really important and will help me develop my skills more. Manchester also has a really good local area. I have a lot of family support in Manchester, and family is very important to me. So I know that the step to medicine is a huge step away from home. It's going to be a different step in life, and I might have some struggles, but having that support system around me is going to be important to me. Manchester's also a really big travel hub, so I can get home if I want to for the weekend and go and sort of see my friends. So you'd say stuff like that, and then you'd say like, I don't know, I play tennis. Manchester has a really good tennis team that I wish to play for whilst I'm at their medical school. So you talked about the course, you talked about the environment, you talked about support systems, and you talked about hobbies. So you've covered 4 things there. And with the adrenaline and with the time in the interview, by the end of it, you're probably gonna have run out of time once you settle with those 4 things. Why medicine? A lot of the universities, we just use this as an icebreaker. It's just to help you settle down a bit more into the interview. So we won't mark this question. A lot of universities would just double check. Newcastle, we won't mark this question. It's just like just to sort of ease you into the interview because we know that you're a little bit stressed. Can you talk about medicine with a foundation year? Yeah. So I don't know much about medicine with foundation years, unfortunately. I know some unis, like I think Nottingham, will offer medicine with foundation years. Um, they often have sort of a smaller number of places, and quite a lot of applicants. Um, I think no, in Newcastle we don't do medicine with foundation year. I don't know. I don't know much about it, unfortunately. Um, I know a lot about the transfer system. So at unis like Manchester and Newcastle, you can do another course for the first year. So like um, biomedical science or something like that. You do that for a year, and then at the end of the year, you can transfer over if you're to medicine. If you're you do have to do another UCAT and have to be interviewed as well. But if your like sort of averages are really good for the year, they do allow you to sort of apply to that transfer scheme. So I probably know a bit more about that than medicine with a foundation year. But if you have a specific question about medicine with foundation year, if you just put that in, because that probably make it a little bit easier for me to answer. So communication station. So there's often going to be a role play station in your interview. Um, I can't unfortunately talk about any of the role plays I had because I think they still use the role plays that I had. And I also signed a form not to discuss the interviews at one of my unis. I know it's 6 years down the line, but I cannot afford to get in any trouble before I start medicine. This is before I start doctoring in July. So I can't talk about them, but a common one that some unis may use or may not use will be something like your friend has cheated on this exam, talk to them about it, or your friend is struggling, talk to them about it. So test your skills, communication skills, and you just need to be calm. You need to be compassionate and think about what you'll say before you say it. So silence is so important, and silence is such a useful thing. So utilize those silences in order to help you think about what you're going to say. It's okay to take time to think about what you're going to say. In reality, you'll know that person a little bit better, I hope, that you're talking to, but this is an interview situation. So think about things before they come out of your mouth because you don't want to dig yourself a hole in your interview. Breaking bad news is also one. So the one I sometimes use with my TTs will be about I'm your next door neighbour, you just run over my family cat. Tell me. So you just need to be calm and you need to be honest about what's happening and think about pacing. So in breaking bad news, the biggest piece of advice I can give you all here is use the spikes model. So the spikes model is what we use as a doctor. So it is as a medical student as well, it's SPIKES, and it stands for various things. So the spikes model is really important for breaking bad news. So it stands for I should know what it stands for essentially, but I think because I just do it now, I don't actually know what everything stands for anymore because I've just been doing it so long. So spike stands for setting up, so how you set up the situation. Perception, so what do they know about what's been going on? Do they know anything? Invitation, so if they want to ask you any questions. Knowledge, you show any knowledge you have about the situation. And then E stands for emotions, with empathy, and the last S is sort of summarizing the entire experience, or it's the entire thing that you said, and making sure they're okay. If you can do the spikes model quite successfully in your interview, I think that's just gonna probably make you shine, because people in my year will still struggle with doing the spikes model. Um, so if you can do that, it's really going to make you stand out from the crowd. And then chunk and check. So during the interview, during the role play, you want to keep checking that they're understanding what you're saying and that they're following what you're saying. Um, it's an important thing as a student as well, because you don't want to sort of power them with too much information. So with real patients, you want to be compassionate. You want to let them talk. Um, Patients love talking, but you just have to let them talk. I went to see a patient. This was on my last rotation at palliative care. They literally went into her room just to check she was okay. It was just a quick review, and it was literally like, "How are you doing?" And I must have spent 40 minutes in that room because she just wanted to talk. And I sat there and I was just like, you know what, just talk. Like, fair enough. Like, I'm actually like actively, if I had anything to do, fair enough. But she just wanted a chat. She hadn't seen it. She hadn't had any visitors for like 2 days. So just let them talk to you. Um, and letting them talk is often you just being compassionate as well, that you just understand. Don't over medicalize things. So it's very it's very easy to just talk about what you sort of learned. Like, I was just talking about the pulley system. You guys have no idea what the pulley system is. Well, most of you won't have any idea. Some of you probably will, but most of you won't. That's me over medicalizing things. I would just talk about the system that controls how easily your fingers flex and extend. That's the non-medical way of saying it. So don't over medicalize things. Show empathy to your real patients as well. So an example they could give you in the interview is like, speak to this real cancer patient about their experiences. So you'll have to sort of do all those things in order to do it successfully, I guess. And the one I've just said, tell your neighbour that you've run over their cat. So ethics and decision making. So your ethics stations, you want to have quite a calm and ordered approach. You want to have balanced arguments, and you want to avoid your own opinions. I often use this sentence. Some people may say, rather than saying it's my own opinion, because you don't want to wind up in an argument with your interviewer. Try and have some good background knowledge. So there's loads of different websites. I think SixMed have quite a lot of them, quite a lot of summaries and different ethics as well. So read up on those. So what to know? You want to know the proper way to gain consent from a patient. You want to know what Gillick and Fraser's competency is. So that's for people under the age of 16 to check if they are competent enough to make a decision. You want to know how to measure someone's capacity. So that is the ability to understand, retain, weigh up, and communicate decisions. If you have all those four things, then you do have the capacity to make a decision. And it's also important to note that you can have capacity to make one decision, but not capacity to make another. And also that not just because someone's making an unwise decision does not mean that they lack capacity as well. So those are key things for you guys to know. There's also 4 pillars of ethics, which really testing me now. So this is, I think it's beneficence, non-maleficence, justice. And there's another one that I just completely blanked. If any of you guys know it, put it in the Q&A. But the 4 pillars of ethics are important as well. Autonomy is the last one. Yes, thank you. So autonomy, the right for people to make their own decisions. And then you need to know about professionalism and how to maintain that professional aspect. So that's probably going to be about not talking not talking about patients outside of the workspace that's identifiable for other people. And then like that confidentiality as well. And accountability. So taking accountability for your actions. If you've done something wrong, if you've done something right, you want to take accountability for that. And making decisions, you want a clear answer, a good structure. You want to always have balanced arguments as well. And you want to make a conclusion with your decisions as well. So an example is you prescribe the wrong medication and a nurse is going to administer it. What should you do? So that's taking accountability. You prescribe the wrong medication. You want to take this straight up to your top priority because you don't want this patient to get given the wrong medication. You explain to the nurse that you've given the wrong medication. You apologize to the nurse, but you also apologize to the patient as well. So you guys are probably going to ask me, why do I need to apologize to the patient if they didn't get the medication anyway? It's just to maintain transparency. We apologize for literally everything. So you just want to maintain your accountability and to show that you've sort of corrected what could have gone wrong as well. So weird stations. If there's any weird stations, then just stay calm, answer their questions, use your knowledge and previous skills, and do not let it affect your performance in other stations. So the greatest piece of advice that my mum gave me during my interviews was treat every interview station separately. So as soon as you leave that station, even if it's gone badly, clear mind for the next one. That is the good things about MMIs. If it's a panel interview, it's not the same. Glasgow was a panel for me, so it really wasn't the same. But MMIs, you can treat each individual station as an individual station, and you should. So don't let it affect you at all. So an example is 21. They might 21 question you. They might ask you to describe an image. They might ask you what the average number of words are in the book. They might ask you what's the one piece of thing, what's one item that you would take to a desert island with you. Just stay calm. Just think about it. So do not forget UCAT preparation. UCAT preparation is so important. So I recommend that everyone does about 6 to 8 weeks of UCAT preparation. I think UCAT preparation is so important because it's the first barrier. If you don't do well on your UCAT, that's it. It is an aptitude test, so I guess you can only prepare for it to a certain extent, but you want to put yourself in the best position to do as well as possible. Don't neglect your A levels either. So you want to get good A level results, as I'm sure all of you do here. Some of you might already have good A level results. But you want to get good A level results in order to put you in the best position. Know what your medical school is looking for, and know what you're looking for in the medical school as well. It's really important, vice versa. And be yourself is so important. So if anyone has any questions, if you just pop them in the chat, that would be great. If anyone wants to talk about sort of any interview prep, UCAT preparation, SIXMED do offer UCAT preparation, interview preparation. BMAT doesn't exist anymore, so they don't offer BMAT preparation anymore, I don't think. We've got a UCAT bank as well. So if anyone's interested in any of those things, if you just email the SIXMED site, and they can address that and pair you with somebody who suits your needs. How do you find out the information on how different unis shortlist for interviews? So most unis will shortlist by UCAT score, but a lot of unis are very transparent. Open days, they'll give out that information, and if you just Google it, it will literally be on. It'll be on Google somewhere. Does anybody else have any questions? If you do not have any questions, you are completely free to go and enjoy the rest of your Sunday. No worries. No worries. Good luck as well for any applications. No worries.